Polymyalgia rheumatica versus fibromyalgia. Don't get them confused. This is the short and simple comparison between the two solely for the context of step 1 and test taking. From this point on, polymyalgia rheumatica will be referred to as PMR. So let's get started. For PMR, think of the word inflammatory. When thinking about fibromyalgia, think psych. So PMR, what are the main symptoms? As with other rheumatologic conditions, patient experience aching and morning stiffness, particularly the neck, bilateral shoulders, and the hip girdle. For fibromyalgia, we are talking about chronic, so over 3 months, widespread muscle tenderness, and the key word here is tenderness, implying an increased sensitivity to stimuli, such as palpation. They will have tenderness in multiple sites, and these tender points can be easily found online. If they're mentioning tenderness in multiple very specific anatomical points, such as muscle insertion points or bony prominences, be highly suspicious of fibromyalgia. If the question is noting tenderness to gentle palpation and multiple sites, even if all that are mentioned are again the neck, shoulder, or hip, common with PMR, still be suspicious for fibromyalgia. Next is age group. For fibromyalgia, it's generally females between the ages of 20 to 55. However, this is not reliable as I have seen board review questions that were outside of this range. As for PMR, the age is actually much more reliable. It is almost never seen under the age of 50. There is no real gender preference, and just for your information, the peak incidence is between the ages of 70 to 80 years old. Now moving on to associated symptoms. Because PMR is inflammatory, think systemic symptoms such as fever, malaise, or weight loss. It's also important to note, other than the aching and stiffness and constitutional symptoms, don't expect many other symptoms. They don't have the joint swelling or the muscle weakness that may be seen in other inflammatory rheumatologic conditions. Next, there's a key association of PMR that you must know, and that is PMR's association with giant cell arteritis, also known as temporal arteritis. In the question, look for elderly female, new unilateral headaches, jaw claudication, and visual symptoms. Temporal arteritis is an emergency as inflammation can lead to occlusion of the ophthalmic artery, leading to permanent blindness. This condition is diagnosed with temporal artery biopsy. However, if someone has the symptoms of PMR and lack any of the symptoms that I have mentioned for temporal arteritis, then biopsy is not indicated. Likewise, fibromyalgia, being widespread pain, can manifest as joint pains, but similarly to PMR, you will not have the joint swelling or the muscle weakness. When you're thinking along the lines of psych and chronic pain, the associated symptoms of fibromyalgia make a lot of sense. Patients will often complain about fatigue, even with adequate sleep. They will complain about impaired concentration, also known as fibrofog. And comorbid depression and or anxiety are present in 30 to 50% of patients at the time of diagnosis. Next, labs. PMR, as being an inflammatory condition, will have elevated ESR and CRP, which are inflammatory markers. For fibromyalgia, you have completely normal labs. Now moving on to treatment. As we've been talking, PMR is an inflammatory condition. How would one treat that? That's right, low-dose corticosteroids. It is actually so rapidly effective that if you don't see improvement, you probably have the wrong diagnosis. Now, if we're talking about temporal arteritis and you're suspicious for that, start high-dose corticosteroids right away, even before biopsy, because again, it's an emergency. And of course, if they have comorbid PMR symptoms, that will resolve with the steroids. Now, fibromyalgia is more difficult to treat. Thinking along the terms of psych, first line would be lifestyle modifications, and that comes in the form of regular incremental low impact exercise such as swimming, walking, stretching, and strengthening exercises. If that doesn't work, you can move on to monotherapy, and that comes in the form of tricyclic antidepressants, SSRI, or SNRI, again along the lines of psych. If none of those work, you can get a referral to physical therapy or a referral to cognitive behavioral therapy or initiate dual antidepressant combination therapy. I hope that helps. If you have any questions, leave it in the comments below, and good luck.